She's going to be telling us about an examination of biopsychosocial alternative treatments for autism. So, got 15 minutes. Take it away, Sophia.
1 out of 68 children are affected in the USA. Symptoms of the affected include a speech delay, a social withdrawal, and repetitive behaviors. Autism is the word spreading like wildfire. Mind-boggling, desperate parents as they question, how do we care for the biological, psychological, and social needs of our autistic children? My name is Sophia Brink. I'm from Kenyatta College, and I'm here to answer this question by going beyond medications. Medications are often used to treat odd or abnormal symptoms of autistic children. For instance, Abilify and Risperdal are 2 psychiatric medications that were approved by the FDA to treat tantrums in autistic children. Abilify and Risperdal are commonly used to treat depression, bipolar disorder, and schizophrenia. In a study published by Pediatrics, researchers gathered a group of 98 autistic children between the ages of 6 and 17 years old. That group was divided into a group that took Abilify for 8 weeks and a group that took the placebo for 8 weeks. By the 8th week, 99% of those who took Abilify experienced a 25% improvement in their tantrums compared to the 14% of those who took the placebo. However, 57% of those who took Abilify experienced one or more of the common side effects: an uncontrollable movement disorder, restlessness, vomiting, or a stroke. Risperdal was run in the same research trial that Abilify was in, occurring at a rate of 10% in all observed trials. Some autistic children experience side effects similar to that of Abilify. A more severe and fatal side effect was reported with Risperdal as well: neuroleptic malignant syndrome, a syndrome which causes shaking, sweating, stiff muscles, and a high fever. So recognizing the fact that not all autistic children need medication, we can examine alternative treatments with a bio-psycho-social approach, effectively discovering how to aid autistic children as they transition to adulthood. Bio-psycho-social approach is a review of the overall biological, psychological, and social factors affecting human development. Alternative treatments, such as therapies and diets, have proven to be beneficial to many autistic children, as shown in research and studies. But when an autistic child becomes a teenager, parents often wonder, well, what's the best alternative treatment for my child as they transition to adulthood? Considering autistic teenagers' different psychological and social needs as they transition to adulthood, a bio-psychosocial approach can be used to meet these needs. As all children do, autistic children face many challenges and difficulties when they become teenagers. However, the lack of communication and understanding of abstract concepts in some autistic children further prevents them from understanding the concepts of puberty, modesty, socialization, and the role of a self-identity. Research recently published from the CDC has found that developmentally disabled adolescents are 1.5 times more likely to be obese than neurotypical adolescents. Autistic teens were found to be at greater risk, 2 times more likely to be obese than neurotypical teenagers due to a lack of behavior regulation and a lack of social skills. Psychological and social needs of autistic children changes into the needs based upon a self-identity. Although some autistic children may not be able to communicate effectively or understand abstract concepts, they still desire to be valued by their parents, to be included in a social activity, and to learn the techniques to overcome the physical and emotional challenges of puberty. ABA therapy, or applied behavior analysis, is a therapy that acts to modify behaviors in autistic children. An ABA therapist helps the child develop basic essential skills, such as reading, listening, daily living skills, and learning the perspectives of other people. ABA therapists also help the child decrease self-interest and aggressive behaviors. At the Princeton Developmental Institute, the correction of disruptive and stereotypical behaviors commonly found in autistic children between the ages of 11 and 18 years old were focused upon in an experiment. In the experiment, an ABA therapist presented 24 various social stories to each child. If the child matched the social story with the appropriate response, that child would receive a token in exchange. If 24 tokens were achieved, then that child would receive a desirable item in exchange. Researchers concluded that this ABA therapy method of a token economy produced positive results in all participants of the experiment. Autistic people often struggle with beginning and maintaining shared attention and expressing their emotions in an appropriate manner. Music. The instrumental and vocal sounds united to create a beauty, harmony, form, or emotional expression has been utilized as an alternative treatment for autistic individuals to achieve these needs. The progression of behavior, communication, and socialization are goals often approached by music therapists. According to the Journal of Music Therapy, goal fulfillment in music therapy is reached within 1 year for all autistic individuals. Healthy eating and regular physical activity is vital for a healthy lifestyle among all teenagers. Many autistic children are unable to participate in a sport or other physical activity due to a lack of behavior regulation and a lack of social skills. Many ABA therapists often incorporates a physical activity that a child enjoys, such as soccer or basketball, to teach the child how to interact with others and communicate effectively. In addition to ABA therapy, Autism Speaks advises parents to decrease their child's intake of salt, sugar, and fatty foods to maintain normal physical development for their child. The use of alternative treatments is widely deliberated for autistic individuals. Parents hold some concerns about some therapies as they think that the therapies won't cure autistic symptoms. Some parents think that medications can be a cure for autism as the symptoms are suppressed. Medications may temporarily suppress some behaviors in some autistic children, but it doesn't treat the problem. According to the CDC, there is no such medication that can cure or even treat the main symptoms of autism: lack of eye contact, speech delay, and lack of socialization. Parents are encouraged to try some alternative treatments for the sake of their child. The parent-child relationship is crucial to the effectiveness of the alternative therapy and the success of the child. Parents are the #1 advocates for their child as they understand their child best. Therapists often implement training for parents, encouraging parents to provide feedback and tools to aid the efficiency of the particular therapy. Moreover, parents are recommended to include their child in daily home and family activities, such as cooking, carrying out chores, and eating at the dinner table. By doing so, autistic children are able to learn how to interact with others and regulate their behaviors, and eventually gain a self-reliance and social awareness. The transition to adulthood is an extremely stressful time for both the parent and the child. Parents are often overwhelmed about the future possibilities for their autistic child. The studies have found that there's a lack of support for autistic adults. The typical route for an autistic child to follow is a placement in a group home or vocational training for a job, while still being assisted by an aide. Some autistic children are able to successfully engage in one specific activity, such as music, art, or cooking. ABA therapists often involve the specific activities that a child enjoys. Music therapists often encourage autistic children to continue their involvement in music. Consequently, future professional and work-related possibilities in the activity may be other outcomes. My brother, Sam, is 15 and he has autism. When living with a neurological condition or with a loved one who has one, it can be very easy to focus on the challenges and limitations set by that disorder. From my experiences with my brother, I have found that we must focus on new ways to adapt and to cohere. Focus on the abilities rather than the disability. Autistic people are not broken or damaged or need to be fixed. Sure, they may act, think, or behave differently, but different can be a good thing. Autistic people are bright and humble individuals who offer many gifts to our world. So families, therapists, and educators who act to ensure the appropriate roles will be met promise to autistic individuals that they will eventually blossom into their own unique selves one day. Thank you.
We have a few minutes for questions. Questions for Sophia?
First of all, you did a really good job. You were very poised. I love how you presented that. Did you find in your research that with these alternative treatments, that the degree of severity or where they ranged in the spectrum, was that a factor in how well they responded to these alternative treatments?
So you're asking whether they're high functioning or low functioning?
Right.
Yes, in my research and studies, I have found that first it all depends on the child. However, ABA therapy is found to improve the behaviors in both high functioning and low functioning autistic children, because really there isn't really a high functioning or low functioning, because all children are different. So we must try other alternative treatments to see whether or not it is successful or not.
I mean, you made a great point about the medication aspect, is it like hides symptoms, but isn't necessarily the underlying problem. So based on that, do you think there's any place at all for medication in some circumstances, or do you think it's just, it shouldn't be an option at all, and it should be focused on the actual correcting the underlying with the token
It shouldn't be an option at all. Because we have to think, do we want our child to be a walking zombie? Or do we want our child to be looked at as an individual with thoughts and feelings and emotions? That's how I think of it.
It's more in extreme circumstances. I don't know if it's like, okay, it's okay, or it's interesting to know that it's like, no, it's not okay. I find that interesting based on your research.
Well, I think it's not okay.
Yes, I have a question as regards to therapy that is applied that is based on rewards, and because of those rewards is that the clients are presenting a better outcome in their treatment. I was wondering, when the extension of the reward happens, does the client go back in their behavior, or can they actually move forward?
Well, firstly, the token economy is from positive reinforcement. So positive reinforcement is the idea that if a behavior is rewarded, that behavior will likely increase. So all humans, all creatures respond to rewards. It's our nature. So I found that when you first do the rewards, the child will eventually learn that behavior, and then slowly you can extinct that reward, and then that child can do that behavior on their own.
But I mean, there is a point where the extinction actually extincts the response itself. So is there any way, I mean, that you could achieve it with another way?
There is another way. There are many ABA therapy methods besides the token economy. I found in my research that you don't always have to respond to rewards in some autistic children, since every autistic child is different and every children is different.
Thank you.
Further questions for Sophia? All right, well, terrific.